Dr. Dean Vafiadis, prosthodontist at NYU University, private practice 693 Fifth Avenue, New York, New York, and our website is www.nysi.org. The differences in the last 20 years are really based upon the delivery of care. The type of practitioners that are giving care to patients has been very specialized. So 20 years ago, there wasn't a big specialty in any of the countries in the world, whereas today the specialty practice has really taken over. So you have general dentists with specialists working to have a multidisciplinary approach to the patient. That makes for better dental care and for better patient treatment for them. So that's a big change of using the specialists with implants, aesthetics, the occlusion, the bite, to use specialists to make that change. Adaptation there, the dentist was doing everything. 25, 30 years ago, the dentist was in charge and making all the decisions. Whereas now, the adaptation process is the dentist can focus on a certain type of dentistry, aesthetics or orthodontics or pediatric. And I think that makes for a better clinician because he's only focusing on one aspect of dentistry. And the specialist can focus on that. So the general dentist has a lesser focus, has a better focus on what they want to do instead of a broader focus trying to do everything. Sort of like building a house. You don't want one person doing everything. You want different people doing certain things. Well, the digital technology today in 2018 has really changed the digital experience for a patient. So where the patient used to come in and fill out paperwork, their chart was on paper, that now it's all digital. The x-rays used to be with film and chemicals are now all digital. The impressions used with very different types of materials that are very hard to handle for the patient, now it's all done by digital cameras. The dentistry, the actual crowns that are made, used to be made with wax and, again, bad materials, bad odor, bad chemicals, and now it's all done by milling machines and done by printing machines and digital technology. So as a patient comes into a dental office, it's very different than it was 20 years ago. It's a much easier experience. It's more predictable, less visits for the patients. It's more comfortable. The environment's not intrusive. It's not scary anymore. So I think that's a big change of the digital technology. Well, private practice seems to be leading the way because the patients are expecting more from the private practitioner. In the university setting, there's a lot of policies, there's a lot of departments, so it takes a little bit longer for those techniques to really evolve in a dental environment, a dental school. Whereas a private practitioner can make the choices that are best for him, financially, digital-wise, the best materials, they can choose what they want for their patient. Whereas the university a lot of time relies on the overall, dental school to make those decisions. So the impact for has changed in the private sector because patients demanding more aesthetics, demanding more easier procedures. The implant dentistry profession has gotten faster because everything is digitized and technology makes everything more predictable. There's less errors, there's less redos because of the digital technology. So NYU's biggest advantage is that we have global presence around the countries that we've worked with for the last 25 years. We have 47 countries that we work with. That brings in a lot of different people. So with more people that come into New York University, we get different ideas, we get different research projects. We have much more influence from other countries, and as we influence their countries and their dental education. So I think dental education at NYU is paramount, probably one of the most in the world. I've been involved for 25 years in full mouth rehabilitation, and that education process right now is all digital. There's very few schools that are at that level of digitalized technology around the country and around the world. I think you have a beautiful place. I think you have a beautiful population. I think that Indian dentists want to learn. Their education commitment is very, very strong. We've been doing 20 years at the Smile Center. I think the focus of the culture that you have is a very proud culture. Like my parents are from Greece. We're a very proud culture. We want to do the best for our patient. I think that's what India I see in the people here. They really want to learn. They want to do the best they can. And we've had the most influence from India at NYU. One of the largest conglomerate of dentists coming from different countries is from India. So we've been very influenced by them, and I really appreciate being here. Thank you.